You might have come across the term ectopic pregnancy in the newspapers, in the books, or on the internet, but might not have known what it actually means. So, what is an ectopic pregnancy? Ectopic pregnancy is a special kind of pregnancy where you get pregnant outside of your uterus and which at times might not even have the usual symptoms of pregnancy, making it difficult for you to know that you are having ectopic pregnancy and to get treatment for the same.
During a normal pregnancy, the fertilized egg implants into the wall of the uterus cavity and starts growing. But sometimes, the egg does not reach the uterus and begins to grow outside of it. Ectopic rupture causes life-threatening blood loss, but identifying an ectopic pregnancy before it is ruptured is not always easy. How and when does ectopic pregnancy occur? In most cases, ectopic pregnancy tends to occur in the fallopian tubes, though rarely, it can also occur in the stomach or the abdominal cavity. While in almost all cases, the baby can never be saved, if the condition is not diagnosed in time, it can also be fatal for the mother. And even if the baby survives, there are high chances of the newborn having congenital disabilities. Instances of secondary abdominal pregnancy are difficult to identify at an early stage owing to technological limitations and lack of experience in handling such cases.
How does ectopic pregnancy affect the body? Ectopic pregnancy can cause severe complications and needs to be treated early. If it is detected before rupturing and before bleeding begins, then it can be treated with medication.
However, in case the pregnancy is not detected, it continues to grow and can lead to a ruptured ectopic. Here, the fallopian tube bursts and leads to life-threatening bleeding inside the abdomen. In this situation, emergency surgery is needed to treat the patient. After the surgery, if one fallopian tube has been removed, there is still a good chance of future pregnancy. How is ectopic pregnancy detected? In most ectopic pregnancies, the embryo will usually rupture within 7 weeks, even before the pregnancy can be confirmed, and the situation will come to light only after the individual develops internal bleeding due to the rupture. People who have an ectopic pregnancy don't always have symptoms early on. When early signs do happen, they include light or heavy abnormal vaginal bleeding, sudden, sharp, occasional, or continuous abdominal or pelvic pain, which may occur only on one side. In the later stages, weakness, dizziness, or fainting can occur when the ectopic pregnancy starts bleeding internally. And in the final stages, shoulder pain can occur after the ectopic has ruptured, causing massive amounts of blood in the abdomen. Do some individuals have a higher chance of ectopic pregnancy? People who have abnormal or damaged fallopian tubes, such as from past infections or surgeries, or have had an ectopic pregnancy before, have a higher chance of getting an ectopic pregnancy. Further, cigarette smoking or certain conditions that are spread through sexually transmitted infections or specific treatments to help get pregnant might also cause an ectopic pregnancy. People who use a type of birth control called an intrauterine device or IUD have a meager chance of getting pregnant. But if a person using an IUD does get pregnant, they are at a higher risk of ectopic pregnancy.
Can ectopic pregnancies be prevented? Most ectopic pregnancies cannot be prevented. And if you're planning to get pregnant, there is nothing specific that you can do to prevent an ectopic pregnancy. However, early diagnosis and therapy have helped to reduce maternal deaths caused due to ectopic pregnancy. In rural and backward areas of the country, diagnosing ectopic pregnancy is challenging, making it a significant contributor to maternal mortality.
Given administrative ignorance and urban apathy toward rural healthcare infrastructure, there is a considerable delay in ectopic pregnancy being diagnosed, and primarily, it is not even diagnosed due to systemic inequality. Hence, most ectopic pregnancy related deaths occur in backward rural areas, making it a cause of grave concern and a public health issue. Serious research and advancements in technology, as well as a robust healthcare system, need to be in place in order to tackle this issue.